Assalamualaikum and hello, my name is Ahmad Nabil Marihizan and today I will be presenting on viral hepatitis for my MLT 543 clinical virology video assignment. So let's move on. So what is hepatitis? Hepatitis simply means inflammation of the liver, an organ that plays essential roles in detoxification, metabolism and digestion. And viral hepatitis refers to liver inflammation that caused by 5 major viruses, which are hepatitis A, B, C, D, and E. These infections are a major global health issue and can lead to serious outcomes such as liver cirrhosis and liver cancer. So in this presentation, I will be explaining about the overview of the disease, its causes and transmission, symptoms, risk factors, and the control and prevention strategies. So let's move on to the first slide, which is overview of viral hepatitis. So, overview of viral hepatitis. So there are 5 types of hepatitis viruses, which are hepatitis A and E. They are RNA viruses that spread mainly through contaminated food and water. While hepatitis B is a DNA virus, and hepatitis C and D are RNA viruses that transmitted through blood and bodily fluids. So hepatitis infection can be acute, lasting for a short period, or can be a chronic also, which may continue for years. So hepatitis B and hepatitis C are especially dangerous because they are often progress to chronic illness and can cause liver scarring and liver cancer. So the World Health Organization aims to eliminate viral hepatitis by 2030 and highlighting how serious and preventable this condition is. So that's for overview of viral hepatitis. So let's talk about causes and transmission of hepatitis. So, viral hepatitis is mainly caused by infections with hepatitis viruses A to E. So, hepatitis A and E spread through the fecal-oral route, usually from contaminated food or water. And next we have hepatitis B, C, and D that spread through blood and bodily fluids, including doing unprotected sexual contact, sharing needles, and screen blood transfusions, and mother-to-child transmission during childbirth. So while today's focus is on viral causes, so hepatitis can also occur due to alcohol misuse, autoimmune disease, or drug toxicity. So without wasting much more time, let's move on to the pathophysiology of hepatitis. So, for pathophysiology of hepatitis, all hepatitis viruses target liver cells that are known as hepatocytes. The immune system tries to fight the infection by attacking these infected cells, and this will lead to inflammation and swelling of the liver. So if the infection becomes chronic, especially with hepatitis B or C, the ongoing inflammation will causes liver scarring known as fibrosis. So over time, this can progress to liver cirrhosis, which is liver failure, or hepatocellular carcinoma, which is the most common type of liver cancer. Thus, this is why early detection and treatment are very important to prevent long-term damage to our liver and our body. So, for symptoms and clinical feature of hepatitis, symptoms depend on the type of virus and whether the infection is acute or chronic. So, acute hepatitis may cause fatigue and general weaknesses, fever and nausea, loss of appetite, jaundice, dark urine and pale stool, and you will feel at the abdominal pain. So that's for acute hepatitis. What about chronic hepatitis? So chronic hepatitis, especially B and C, It's very dangerous because it may remain silent in our body for years with no symptoms, which makes screening important. And chronic hepatitis could give us liver cirrhosis or liver cancer. So next we should move on to risk factors of hepatitis. So the risk of viral hepatitis depends on lifestyle, environmental exposure and healthcare safety. For hepatitis A and E, the main risk for a person may include poor sanitation of environment, eating contaminated food and drinking unsafe water. While for hepatitis B, C and D, the risk includes unprotected sexual activity, sharing needles or injecting drugs, sharing razor or toothbrush from other people that might have infected by hepatitis viruses, receiving unscreened blood, and also being born to an infected mother. And not also that, healthcare workers are also at risk due to needle stick injuries. We call it as a nosocomial infection within healthcare workers. Okay, and also alcohol misuse, HIV co-infection, and lack of vaccination increase complication of the viral hepatitis. So let's move on to the next slide, which is the control and prevention strategies for hepatitis. So viral hepatitis is highly preventable with the right strategies. So vaccination is the most effective tool, because vaccine exists for hepatitis A and B, and the hepatitis B vaccine can also protect against hepatitis D. So for hepatitis C, although no vaccine is available, modern direct-acting antiviral can cure most infections with high success rate. And we also have other prevention methods, includes we need to practicing safe sex activity, and we should avoid needle sharing, and we must always screening all donated blood, and ensuring clean water and proper sanitation of our hands or our body, and public education and awareness campaigns, and lastly, routine screening for high-risk groups. This measure can significantly reduce both infections and complications. So we have come to the end of our presentation. Let's move on to the conclusion. So in summary, to conclude that viral hepatitis is a major global health problem that caused by 5 main viruses that can spread through contaminated fluids, unsafe water, blood or bodily fluids. So when we do the early diagnosis like vaccination, good hygiene and safe practice are the key steps to preventing infection and reducing complication of hepatitis. So with effective prevention and modern treatments, we can support the World Health Organization's mission to eliminate viral hepatitis by 2030. So that's all from me. Thank you for listening, and here I put the reference for your use. So that's all. Thank you again, and thank you for listening. Thank you. Assalamualaikum.